Many ladies or adult women experience enlargement of the labia minora and majora that leads to cosmetic, psychological or even functional issues. Hello, I am Dr. Chaitali Trivedi, a gynecologist and obstetrician practicing in Mumbai. Today in this video, I will discuss labiaplasty surgery in detail. So, enlargement of one or both sides of the labia minora or an asymmetry often results in increased irritation or discomfort of sensitive skin during regular activities, painful intercourse, and decreased personal hygiene at the time of menses. Moreover, they also face self-consciousness, increased anxiety levels, embarrassment when wearing tight clothing like yoga pants, bathing suits, or even tight jeans, and feelings of insecurity while having sexual intercourse. Many women are not aware that there is no need to silently suffer from chafing or rubbing or any other discomfort during exercise or sexual intercourse, because this condition can be addressed with labiaplasty surgery. It is a surgery that can help provide desired labial appearance, alleviate associated physical concerns, and also address its functional aspects. This can involve both the labia minora and the majora, or either of the two, as per the patient's requirement. Labia majora is the outer set of skin around the vaginal opening, and the labia minora is generally covered by it. Another common difference is the hair growth on the labia majora, which is absent in the labia minora. Now, here are some commonly asked questions that I am going to answer about labiaplasty surgery. What exactly is labiaplasty? Well, labiaplasty is also referred to as a vulval surgery or a designer vaginal surgery. It's a cosmetic procedure performed to reduce or reshape the folds of skin on either side of the opening of the vulva, that is the labia majora and minora, also known as the outer lips and the inner lips of the vagina. Also, one must take a note that it is an intimate and fragile part of the body. So, the surgery is only performed by an expert cosmetic surgeon who also understands the anatomy of the female genitalia completely. So, why is this surgery performed? Now, naturally, women have different shapes and sizes of the lips of the vagina on either side. So, some factors can affect the size of the labia, such as hormonal changes, a vaginal trauma or injury. It could be hereditary, pregnancy, or aging. The reasons for seeking a labiaplasty surgery include both functional and aesthetic concerns. People have different perception of their desired shape and size of the labia, but the commonly requested labia appearance is a smaller and a more compact look. Who all can go for this surgery? Well, labiaplasty is an elective procedure, but the candidates who would be undergoing labiaplasty should be women who are above 18 years of age, because the labia development continues till early adulthood, even after adolescence. A physically and psychologically healthy woman with some discomfort from the labia or bothered labia appearance. Now, she must have a realistic expectation of what she wants to achieve from the surgery. Women who are not currently pregnant, obviously. So, the suitability of the candidate for the surgery is determined by the specialized gynecologist or the plastic surgeon during the initial consultation. So, what does the surgery involve? Well, the first initial consultation ensures that the candidate is completely comfortable discussing the surgery. It is kept discreet as well as private. Now, during the personal consultation, the patient is asked about their specific issues to be addressed and their expectations or desires from the surgery. The doctor also makes use of this time for a complete physical evaluation of the genital area and the assessment of the overall physical health of the individual. Some points may be taken into account, such as the size and the structure of the labia and the symptoms being experienced. A discussion will be made regarding various surgical methods available to correct the labia, the steps of the procedure and the associated risks or benefits. If the surgeon finds a woman to be a good candidate for the surgery, then the final decision to take up the surgery or not is left to the candidate, of course. The best course of action that satisfies the needs of the patient is then recommended by the doctor, along with a detailed breakdown of the entire treatment and the costs. Moreover, the doctor might take photographs of the patient's genitals before the surgery, if the patient allows, for comparing with the after surgery photos and for the medical records. For a successful labia surgery, the candidate needs to find a reputable plastic surgeon who holds knowledge and expertise in dealing with any abnormalities in the labia anatomy. How to prepare for labiaplasty surgery? Now, before the labiaplasty surgery is conducted, the surgeon ensures that the patient is well prepared for the operation so that the procedure ends smoothly as much as possible. This can be checked by looking at whether the candidate has followed complete set of guidelines given by the doctor before the surgery. The preoperative care instructions usually include: stop the intake of certain medications like blood thinners or NSAIDs, as they may result in bleeding complications. Discontinue smoking cigarettes for at least 6 weeks prior to the day of surgery, as it can result in a wound breakdown and implant infection that ultimately may need to be removed. Arrange for some help during the recovery period at home, as well as find someone to drive you home after the discharge from the hospital. So, on the day of surgery, plan to wear comfortable clothing and arrive an hour before the agreed timing of the surgery. Avoid overfilling of the stomach and bladder for at least 6 to 8 hours before the surgery by not consuming any heavy food or drinks. However, small sips of water are allowed up to 2 hours before admission into the operation theatre. Now, I am going to discuss the procedure in detail. Labiaplasty is a day care procedure that usually gets completed within 60 to 90 minutes. But when combined with vaginoplasty or vaginal rejuvenation, or you can check my other videos for details of these procedures, it may take approximately around 2.5 to 3 hours. Before the surgery begins, local or general anesthesia is given to the patient so that the entire procedure feels comfortable. This type of anesthesia can vary depending upon the case. Now, during the time the patient's vitals are checked, the surgeon marks the final markings of the area to be treated after determining the incision pattern that suits the patient. Now, there are two main types of incision techniques that are discussed below. Trim labiaplasty. This method is apt for women whose labia minora is slightly larger than the labia majora. In this technique, the extended edges of the labia minora are trimmed to create a proportional vulva. The surplus skin is excised from the labia and the edges are stitched. It benefits the women who have dark labial edges and wish to get rid of the darkened skin to achieve normal pink colored vibrant labia minora. The second is wedge labiaplasty. As the name suggests, this technique involves the removal of a wedge shaped piece of tissue from the labia, similar to how a garment is tailored. In this procedure, the edges of the labia are not at all touched, thereby giving a natural organic appearance for the labia. After the wedge resection, the wounds are closed with fine absorbable sutures. Following the procedure, the patient is sent to the recovery room for a few hours depending upon the scale of the surgery. Soon after the completion of the required observation period, the patient is allowed to go home. So, what happens after the surgery and what is the recovery period? Soon after the surgery, it is normal to expect some mild pain in the surgical site, accompanied by slight bruising or swelling. These symptoms usually resolve after a few days. Some painkillers can be given to reduce the pain and swelling. Any other discomfort like itching or irritation that may occur at the time of healing, which can be relieved by use of ice packs, cooling sprays or even topical moisturizers. After the surgery, the final results can take a few months to be noticed. Most patients resume their work and light routine activities after about 2 to 5 days. The patient must also follow the aftercare guidelines to achieve the best outcomes. This includes wear loose garments including underwear so that they do not irritate the skin after the surgery until the treatment site heals. Using running warm water after urination to ease the discomfort. Avoid using tampons until the doctor suggests so. Go for sexual abstinence for about 6 weeks after the surgery. Do not go to swimming pools or hot water baths until the doctor allows. Avoid any physical activity that can worsen the incision site, such as squatting, scratching, and prolonged sitting. Take complete rest for a few days until the swelling and pain subside. Avoid strenuous exercises for a few weeks. Then you need to take an appointment with the surgeon after a week of surgery to review the incision sites properly and to discuss the progression and ongoing treatment for supporting the scarring and healing process. A final checkup can be done with the surgeon after about 6 to 8 weeks of the surgery. People often ask about the risk associated with labiaplasty surgery. Every surgical procedure has some risks involved. Labiaplasty rarely involves any risks or complications after the surgery if it is performed by an expert surgeon. After labiaplasty reduction, some patients might experience infection, bleeding, tissue scarring, less genital sensitivity. Other than that, there can be an allergic reaction to the anesthesia also or a blood clot formation in the vein. However, trained and experienced surgeons would always assess the risks in advance and plan the surgery accordingly to avoid the aforementioned complications. People also ask whether labia reduction is possible without surgery. Yes, other alternatives include non-surgical radiofrequency treatment. Now, their results are temporary and vary among different patients. Even some creams, exercises and home remedies claim to reduce the labia size, but they are scientifically proven to be ineffective and are a waste of money and time. If the patient is looking for a permanent, guaranteed way of reducing labia surgery, then surgery is the best and only approach available. If you have any questions about the surgery, you can consult me by booking an appointment via the website or calling on the contact numbers given on the screen. If you have found this information useful, do not forget to like and share this video with your friends and family. Also, subscribe to my channel and press the bell icon so that you can get notified every time I upload a new video. Thank you.